Congratulations on the birth of your new baby. My name is Donna Canton-Russ. I am a registered nurse as well as an international board-certified lactation consultant. Breastfeeding or providing breast milk is one of the most important contributions that only you can make towards the health and well-being of your infant. An effective latch is a learned skill that both you and your baby will perfect as a team with a little time and patience. Manual expression is a wonderful way to entice your baby to latch, as well as assisting if your breasts become full between day 3 and day 5. To do manual expression, you want to put your thumb about 1 inch to 1.5 inches back from the nipple, as well as your 2 fingertips, gently pushing straight back into your chest wall and compressing your thumb and fingers together, moving slightly forward. Repeating that a couple of times will encourage some colostrum or milk to come out onto the nipple to encourage your baby to open its mouth nice and wide. When positioning your baby, you want to make sure first of all that you're nice and comfortable, sitting in an upright chair with a pillow to support your forearm, a footstool to support your feet. You will try and undress baby so baby is skin to skin. Skin to skin generates body heat, keeps baby warm and alert during feeding, as well as increases your milk production. Turning baby tummy to tummy, placing your hand in between baby's shoulder blades and supporting neck and shoulders. You want to try and get some milk out onto the nipple to encourage baby to open its mouth wide. You'll be touching baby's lip, and with a wide gape, you'd be scooping baby underneath your breast, placing the underneath part of the breast in baby's mouth first, and the nipple gets in last by baby's upper lip. Baby's chin will be in touching the breast, the head will be slightly extended back, and the nose will be free so that baby can breathe. If the nose is not free, you can tuck baby's bottom in towards you to free up baby's nose. Signs the baby is getting enough breast milk are baby's wet and dirty diapers. It is important to record the wet and dirty diapers in the first few days so that you don't have to think about the number. Baby's wet diapers will go along as per baby's age. When baby's 1 day of age, you should see 1 wet diaper in 24 hours, 2 days of age, 2 wet diapers in 24 hours. By the time baby is 6 days of age, baby should be having 6 to 8 heavy wet diapers every 24 hours. Then with their bowel movements, they should have 1 to 2 dirty diapers in the first 1 to 2 days. They'll be dark black-green meconium stools, they're called, and that will progress to transitional brown stools, and then by day 5, it should be yellow watery seedy, which is normal breast milk stools. Baby will regain his birth weight by 10 to 14 days after his initial weight loss in the first few days, and baby will appear content after the feeding. So how often will your baby feed? A newborn will feed about 8 to 12 times in a 24-hour period after the first 24 hours has gone by. Your baby may drink for up to 30 minutes per breast as long as your baby is still drinking and you're hearing swallowing. Some babies will finish the breast sooner than others. Baby decides when the feeding ends, not you. When he's no longer drinking, that's when you're going to unlatch your baby. How to know if your baby is drinking? Once latched, your baby will start with quick, shallow sucks. Once your milk starts to flow, your baby will change its sucking pattern to nice, slow, and deep sucks, where you will start to hear swallowing. Swallowing sounds like a soft K sound. You will hear k, k, k every once in a while. So baby will do a series of sucks, baby will swallow, and then pause to breathe. When baby actually swallows, the chin will drop and briefly hold, and that will be baby's swallow. Allow baby to finish drinking from one breast. Your breast will feel softer after the feed. If your baby is no longer drinking and doesn't unlatch himself, then you can let go of your breast, gently place a finger in the corner of baby's mouth, breaking his latch, and then you will try and see if baby has a burp to do. You can support baby's neck and shoulders, gently pat baby's back for about a minute to see if the burp is there, and then you can change baby's diaper before you offer the second breast. Your breastfeeding resources, when in hospital, is your doctor or midwife, the registered nurses, the lactation consultant. We do offer breastfeeding classes on Mondays, Wednesdays, and Fridays, as well as 2 Saturdays a month that is taught by a lactation consultant. Also, your Blue Book, entitled Caring for Yourself and Your Baby, is an excellent resource. Once you're home, your doctor or midwife, public health, depending on the community you live in, as well as private lactation consultants, La Leche League, and telehealth are all available for you, and again, the numbers are in the back of this Blue Book. The staff at Markham Stouffville Hospital want to support you in your breastfeeding goals. Once again, congratulations.